Hi, this is Mina.
Hey, this is Tony.
Today we want to talk about frozen shoulder. Frozen shoulder is also known as adhesive capsulitis. It's inflammation of the capsule, which is the pocket around the ball and socket joint. Since the capsule is at the center of rotation of the shoulder, it affects the range of motion in all directions. And it's adhesive capsulitis because that inflammation makes the shoulder stuck and sticky and not able to move. So instead of being able to normally range your shoulder in all directions, that range of motion is limited in all directions and limited by that inflammation at the center of the ball and socket joint. This is similar to the range of motion that you'd get with anything else that affects the center of rotation of the shoulder, like a glenohumeral joint arthritis, which is a breakdown of the cartilage between the ball and the socket. And the exam is going to be very, very similar, but the story is going to be a little bit different. So if the patient says, oh, this happened over the course of a couple months, maybe the patient has diabetes, maybe the patient has other risk factors for frozen shoulder, then that patient is more likely to have a normal x-ray and a diagnosis of frozen shoulder. Somebody else might be older. Oh, this has been going on for years, doc. It's been progressively getting worse. And oh, I have a history of arthritis, I have knee replacements, I have hip replacements. Those are patients that are probably going to have an abnormal x-ray and wear between the ball and the socket. And the normal exam the abnormal exam is going to look very similar to this, which is a frozen shoulder exam. So, Tony, can you raise your arm up for us? So you can see Tony is not able to actively forward elevate more than 90 degrees. And if I try to help him with his passive elevation, he's still not going to be able to go higher. So this is the difference between weakness, where his passive range of motion is better than his active range of motion, versus the stiffness that you see with adhesive capsulitis, frozen shoulder, or a glenohumeral joint arthritis, where even the passive range of motion is not able to get to the full forward elevation. External rotation, so Tony externally rotate towards me. So his normal side is able to externally rotate to about 60 degrees, but this stiff side, this frozen shoulder side, is not able to get more than 30 degrees of external rotation, whether he tries to do it or whether I try to help him to get further than that. Tony, can you internally rotate and reach up behind your back? So you can see Tony's trying to get behind his back and up to the middle of his back. He can't get past his belt. He can't get past maybe his sacrum, and it's very limited. And again, it's limited in all three planes: forward elevation, external rotation, and internal rotation, because the disease process is at the center of rotation of the shoulder. And this is different from a rotator cuff problem or any other kind of problem that's away from the center of rotation, because those problems, someone might not be able to raise their arm above their head, and even passively, I might not be able to get their arm above their head. And the reason for that is that their shoulder just hurts too much. But down here at waist level, they should be able to passively externally rotate. And this is a really good telling difference between a rotator cuff problem or any other kind of problem outside of the center rotation of the shoulder and a frozen shoulder, where that passive external rotation is going to be significantly different from the other side. Thanks for tuning in.
Thank you.